A new lockdown in Austria is targeting the unvaccinated. The move, which affects roughly 2 million Austrians, is an effort to slow down a new surge of COVID cases sweeping across Europe. Despite the vaccine's availability, European countries are seeing some of their worst numbers this year. And with travel between the U.S. and Europe resuming and the arrival of winter, health officials are growing worried about a new surge showing up stateside. Joining me now to help get a fuller picture of what we may be seeing here this winter is Dr. Anthony Harris. He's CEO and Medical Director of HFit Health. Doctor, thank you so much for being here.
Yeah, thank you, Ruth.
And we've seen a lot of good news, right? The vaccine is widely available. There are treatment options, but now we see winter coming. We want good news, but we see what's happening in Europe. That's usually a precursor of what's to come here. What do you think? What's your expert opinion?
It absolutely is. And there's a number of tailing factors for that as well. I mean, if we look at what's happening in Germany, they're seeing record numbers, albeit they're only about half of what they were, 2,500 hospitalizations from COVID versus 5,000 during their peak in April. We know that what's driving it are some of the laggers in terms of vaccinations there. They're about 76% fully vaccinated nationwide. We're lagging behind about 58%. And so it's telling that they're experiencing this now, and we're likely to experience the same as the winter's upon us.
And the difference now, correct me if I'm wrong, but the difference now is that they're seeing more cases but fewer deaths.
That's
overall because of the vaccination rate.
That's it. And it is the power of the vaccination that points to, and undergirds that point exactly, right? That they have a good number of people vaccinated. They're not seeing the deaths, but the cases are still rising. So it undergirds that the vaccination is very effective at preventing death and hospitalization, but still we struggle with preventing these transmissions from happening. And so we're in for it because we're behind them about 10% so of the vaccinated population. Some states as low as 20%. So we have some work to do.
And with the surges come the restrictions, the lockdowns. Of course, Americans don't like the lockdowns. And the people who are the most resistant to the lockdowns are also the people who are the most resistant to the vaccine, right?
And that's true, and that's unfortunate, because if we look at ways to get around, the surges that we've seen in the past, I mean, if you look at it now, where we were December last year, we're likely to meet that at least in terms of cases this year. We were lower, about 2/3 lower than we were August, if we compare August to August, right? And we didn't have Delta last year. And so we're expecting, a good number of people that are going to be huddled together to be infected by the household community. And if we look at now the pattern to our north in Canada, they're really good at vaccinations, right? But if you look at transmissions are very low. And we know that they've had mask mandates far longer. They're not expecting to ease their mask mandates until 2022, March, right? And so we got to look to that as a hope to see if we're going to get on the other side of this with just wearing masks versus mandates that are rolling out otherwhere.
And hospitals in the Mountain West in this country are overwhelmed again. Mm-hmm. What, as a doctor, finally, as we wrap it up, what are you going to do? You're vaccinated. What are you going to do for the holidays?
Sure. So we are traveling for the holidays minimally. For Thanksgiving, we will travel to Florida, but everyone's vaccinated. Everyone has had their booster. And that's the key to hopefully getting people, one, preventing transmissions, and two, preventing the death and hospitalizations. I mean, 92%, 93% is what your resistance goes back up to once you're boosted. And so we want people to get boosted. We want people to have fun on the holidays, but obviously we want you to be safe. And those precautions that we've been taking should still be in place.
All right, Dr. Harris, thank you so much for joining us tonight. Nice to have you in studio.
Pleasure to be here. Thank you.
And we'll be right back.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.